Mental illness refers to conditions that affect a person's thinking, feeling, and behavior. These illnesses are real and can cause significant distress and difficulty in daily life. Just like physical health, mental health is important for overall well-being. Mental illnesses can manifest in many forms, each with its own set of challenges. It's crucial to remember that mental illness does not discriminate. It can affect anyone regardless of age, background, or walk of life. Mental illnesses are often misunderstood. This lack of understanding can create stigma, preventing individuals from seeking the help they need. It's important to break down these barriers and encourage open conversations about mental health. By understanding the different types of mental illnesses, their symptoms, and available treatments, we can foster a more compassionate and supportive society. Remember, seeking help is a sign of strength, and recovery is always possible. Mental illness can significantly impact various aspects of a person's life. Daily tasks that were once manageable can feel overwhelming and impossible to complete. This can lead to feelings of frustration, hopelessness, and isolation. Relationships with family and friends may also be strained. Loved ones may struggle to understand the changes they see, leading to misunderstandings and conflicts. Communication becomes vital in these situations, but it can be challenging for both parties to express themselves effectively. Professionally, mental illness can affect job performance, concentration, and attendance. Individuals may find it difficult to focus on tasks, meet deadlines, or even find the motivation to go to work. This can lead to financial instability and job loss, further exacerbating stress and anxiety. The impact of mental illness extends beyond the individual. Families and communities are also affected, often bearing the emotional and financial burden of caring for loved ones. It's crucial to recognize that mental illness is a shared experience that requires understanding and support from everyone. Mood disorders are characterized by significant shifts in mood, energy, and activity levels. These shifts can be extreme, ranging from periods of intense happiness and energy to profound sadness and despair. Two common mood disorders are depression and bipolar disorder. Depression is more than just feeling sad. It's a persistent feeling of emptiness, hopelessness, and loss of interest in activities once enjoyed. People with depression may experience changes in appetite, sleep patterns, and energy levels. They may also have difficulty concentrating, making decisions, or finding motivation. Bipolar disorder, previously known as manic depressive illness, involves extreme mood swings between periods of mania and depression. Mania is characterized by excessive energy, euphoria, racing thoughts, and impulsive behavior. These episodes can be highly disruptive to a person's life and relationships. Living with a mood disorder can be incredibly challenging. But there is hope. Treatment options like therapy, medication, and lifestyle changes can help manage symptoms and improve quality of life. It's essential for individuals with mood disorders to seek professional help and build a strong support system. Anxiety disorders are characterized by persistent and excessive worry or fear in everyday situations. These feelings can be overwhelming, leading to physical symptoms like rapid heartbeat, sweating, and difficulty breathing. Common anxiety disorders include generalized anxiety disorder, panic disorder, and social anxiety disorder. Generalized anxiety disorder, or GAD, involves chronic and exaggerated worry about everyday life events. Even when there is little or no reason to worry, people with GAD may find it difficult to control their anxiety, leading to restlessness, fatigue, and difficulty concentrating. Panic disorder is characterized by recurrent panic attacks, which are sudden episodes of intense fear that peak within minutes. Symptoms of a panic attack can include chest pain, dizziness, shortness of breath, and a sense of impending doom. These episodes can be terrifying and debilitating. Social anxiety disorder, or SAD, involves intense fear or anxiety in social situations, often due to a fear of being judged or scrutinized by others. People with SAD may avoid social gatherings, public speaking, or even making eye contact. This avoidance can significantly impact their personal and professional lives. Section 5. Psychotic disorders. Losing touch with reality. Psychotic disorders affect the mind in a way that distorts thoughts, perceptions, and behavior. People with psychotic disorders may experience hallucinations, delusions, and disorganized thinking, making it difficult to distinguish between what is real and what is not. Schizophrenia is a chronic and severe mental disorder. that affects how a person thinks, feels, and behaves. Hallucinations, which are sensory experiences that are not real, are common in schizophrenia. Auditory hallucinations, such as hearing voices, are the most common type. Delusions, which are false beliefs that are not based on reality, are another hallmark of schizophrenia. These beliefs can be quite elaborate and persistent even when presented with contradictory evidence. Disorganized thinking can manifest as jumbled speech, difficulty following conversations, or switching topics abruptly. People with schizophrenia may also exhibit unusual behaviors and have difficulty with self-care. Section 6. Obsessive-compulsive and related disorders. Trapped in a cycle of thoughts and behaviors. Obsessive-compulsive and related disorders are characterized by persistent, intrusive thoughts, impulses, or images known as obsessions that cause significant anxiety or distress. To alleviate this anxiety, individuals may engage in repetitive behaviors or mental acts, which we call compulsions. Obsessive-compulsive disorder, or OCD, is a common and chronic disorder characterized by these obsessions and compulsions. Common obsessions include fears of contamination, doubts, and a need for order or symmetry. Compulsions are repetitive behaviors or mental acts performed to reduce anxiety, such as excessive hand-washing, counting, or checking. Body dysmorphic disorder, or BDD, is characterized by a preoccupation with perceived flaws in one's physical appearance. Individuals with BDD may spend excessive amounts of time checking their reflection, seeking reassurance from others, or engaging in grooming rituals. Hoarding disorder involves difficulty discarding possessions, regardless of their actual value. People with hoarding disorder may accumulate excessive amounts of clutter, leading to unsafe and unsanitary living conditions. Section 7. Eating disorders. A complicated relationship with food. Eating disorders are characterized by severe disturbances in eating behaviors and related thoughts and emotions. These disorders can have serious physical and psychological consequences. Common eating disorders include anorexia nervosa, bulimia nervosa, and binge eating disorder. Anorexia nervosa is characterized by an intense fear of gaining weight, a distorted body image, and severe food restriction. Individuals with anorexia may engage in excessive exercise, misuse laxatives or diuretics, and have an extremely low body weight. Bulimia nervosa involves recurrent episodes of binge eating followed by purging behaviors such as self-induced vomiting or misuse of laxatives or diuretics. Individuals with bulimia may feel a lack of control during binge episodes and experience intense shame and guilt afterward. Binge eating disorder is characterized by recurring episodes of eating large amounts of food in a short period, accompanied by a sense of lack of control. Unlike bulimia, binge eating episodes are not followed by purging behaviors, often leading to weight gain and obesity. Section 8. Risk factors and protective measures. Mental illnesses are complex and often arise from a combination of factors. Understanding these risk factors can help us identify individuals who may be more vulnerable and implement preventive measures. These risk factors can be categorized as biological, environmental, and psychological. Biological risk factors include genetic predisposition, imbalances in brain chemistry, and prenatal exposure to certain substances. Family history of mental illness can also increase an individual's susceptibility. Environmental risk factors encompass adverse childhood experiences such as trauma, abuse, or neglect. Exposure to poverty, discrimination, social isolation, and stressful life events can also contribute to the development of mental illness. Psychological risk factors include negative thinking patterns, low self-esteem, and poor coping skills. Individuals who have difficulty managing stress, regulating emotions, or forming healthy relationships may be more vulnerable to mental health challenges. Protective factors, on the other hand, can mitigate the impact of risk factors and promote mental well-being. These factors include strong social support systems, healthy coping mechanisms, and a sense of purpose and resilience. Section 9. Seeking help and embracing hope. Recognizing the signs and symptoms of mental illness is crucial for early detection and intervention. Early intervention can significantly improve outcomes and increase the likelihood of successful treatment. If you or someone you know is struggling with their mental health, it's essential to seek professional help. There are various avenues for seeking help, including mental health professionals such as psychiatrists, psychologists, therapists, and counselors. Primary care physicians can also provide referrals and initial support. Treatment options vary depending on the specific mental illness and individual needs. Common treatment modalities include therapy, medication, and lifestyle changes. Therapy provides a safe and supportive space to explore thoughts, feelings, and behaviors. Medications such as antidepressants, anti-anxiety medications, and mood stabilizers can help manage symptoms and improve brain chemistry. Lifestyle changes such as regular exercise, healthy diet, adequate sleep, and stress management techniques play a crucial role in supporting mental well-being. Remember, seeking help is a sign of strength, and recovery is always possible. With the right support and treatment, individuals with mental illness can live full and meaningful lives.